Switching gears now, and growing criticism of the way that doctors are paid, sparking a new effort to change the system. Right now, Medicare and most private insurers rely on doctors to determine what to pay for the work that they do. And now some lawmakers in Washington are hoping to change that. Members of both parties sponsoring a bill that would reshape the whole model. Democratic Congressman Jim McDermott is one of them, and he joins us now. And it's good to see you, sir. Thanks very much for your time. And one of the first things that caught my attention when reading about this was that this bill has bipartisan support. You don't see a whole lot of that these days in Washington.
Well, I think anybody who looks at the national health care system believes that we have to learn to control costs. We've gotten access through the Affordable Care Act. Everybody's in. But then you've got to figure out how to control the costs, and that has been elusive over the last 30 or 40 years.
Okay, so we're talking about the payment that doctors receive when they treat Medicare patients, right? Explain to us the problem. How do you see it? What's going on?
Well, when Medicare started back in 1964, the doctors made it the point for them that they wanted to be paid their usual and customary fees. That means they send in their fee, and then they expect the government to pay whatever they ask for. Well, that has been a problem from the very beginning, and the costs have gone up and up and up. And one of the things that the Congress did was to establish a committee called the Review Committee, the RUC Committee, and that committee was to review each procedure and decide how much it should be paid. Unfortunately, they put it under they allowed it to get under the AMA. It's made up of 31 specialists and other providers, and they decide how much doctors can be paid. So it's really the doctors negotiating with themselves about how much they should be paid. And that simply has been too loose a system, and we're trying to close it down.
Now, anybody who would call you anti-doctor would be mistaken, right? You're a physician yourself.
Sure, I know the system in and out. I practice medicine. I know how it works, but it simply is not sustainable, and we have to begin to find a better way to look at how much a given procedure, how much time it takes, and how much a doctor should be given for that amount of time of effort.
And who should make that call then? If not the AMA, if not the doctors, who, the government?
Well, there should be, what we're trying to do in this bill is to set up an independent panel. There'll certainly be some doctors on there because you need some expertise about what something actually requires. But you also have some people who have no financial interest in it. If you put somebody on there for the orthopedic surgeons and one for the pediatricians and one for the neurologists and one for the radiologists and they all have a financial interest in it. So we want to get some people who do not have a financial interest, who aren't going to get more or less pay because of what they decide on this committee. And I think that's really the only way. If you can get an independent committee of people who understand the field, they can then make reasonable judgments on what doctors ought to be paid.
You know, I've been reading some response from the medical community, and the AMA even admits that the system as it stands is flawed, that changes need to be made. But I just wonder what you're going to run up against if you start saying that the government is going to dictate how much doctors are going to get paid. You know, do you think we're going to run the risk here of discouraging smart young men and women from entering the field of medicine?
No. When we started this, I was in medical school in 1963 when Medicare started. And we were told this was going to be the end of medicine. There'd be socialized medicine. When government got into the healthcare business, that was the end of everything. It's nonsense. Medicare was a salvation for the doctors because it has been a steady source of payment for the care of the elderly in this country. Now, it's never going to be, there's always going to be an argument. A doctor says I'm worth $100, the government gives him $80. The doctor's going to say, I didn't get paid what I was owed. Well, at some point, there has to be some negotiation. And that's really what we have to have is a negotiation between the medical profession and the government about how much we can tax people, how much can we tax the taxpayers, and pay the doctors what they want. The doctors can't be out there independent of that kind of negotiation.
Finally, sir, what's the future of this bill? Where do you see it going?
Well, there's a small piece of it in the change that's being made in the SGR, the Sustained Growth Rate bill that's going through the Congress right now. And there's a small piece of it in there. Whether we get the larger piece in or not, I don't know. But something's going to pass because we have to do something about the cost of health care in this country. And one part of that is physicians' fees. So we can't ignore it. We've got to face it.
Jim McDermott, the longtime congressman from the great state of Washington. Good to talk to you, sir. Thanks very much for your time.
We'll be back.